Welcome to the ACC Professional and Corporate Consortium meeting on patient engagement and patient-centered care. We do have more seats if you're comfortable moving forward. We have some seats. Reminds me of a friend of mine who was criticizing his son for being at the bottom end of his medical school class. His son said it doesn't matter because they teach the same thing at both ends. So we're going to tell the same stories from the back and the front. So if you're comfortable moving forward, please do. Who was Francis Peabody? Anybody know? Francis Peabody was professor of medicine at Harvard. And in 1926, he addressed the medical school class on the subject of the care of the patient. He began his talk by observing that young medical graduates were too scientific. They learned the mechanism of disease, but they didn't learn how to take care of patients. In his words, and I'll quote him, "To put it bluntly, they are too scientific and do not know how to take care of patients." And he ended his remarks, and his paper is actually in JAMA. He ended his remarks with one of the most revered phrases in modern medicine. Quote, "The secret of the care of the patient is in caring for the patient." So today we're going to try to explore and understand how patient-centered care is truly caring for the patient, and how different participants in the healthcare system, and there are many here, all have a role in this, what we'll call a new paradigm of medicine. Now, before going further, I want to go around the room quickly. Just introduce yourself, name and your role in your organization. I'm Henry Solomon. I'm Senior Medical Advisor to the ACC and the Chairman of the consortium. Let's start with our speakers.
Good morning. John Harold, President of the American College of Cardiology.
Yeah, press that.
And I'm Minna Walsh. For the college, I'm the chair of the Patient-Centered Care Committee. I'm also a heart failure transplant cardiologist in Indianapolis.
Good morning. I'm Susie Hughes, and I'm the Clinical Education Project Director for the Preventive Cardiovascular Nurses Association.
So before we start the actual program, please indulge me for a minute. There's some blank pieces of paper in your folders. Jot down quickly your own definition of patient-centered care. I will not ask anybody to read his or hers. Just jot down, how would you define patient-centered care? Just take a minute to do that, and then we'll move on. Okay. While you're doing that, or hopefully you're done, to start our actual program, I'd like to introduce to you the president of the American College of Cardiology, Dr. John Harold.
Well, thank you. Good morning, everyone. Can I have the first slide from my slide deck, please? Well, first of all, on behalf of the 43,000 members of the cardiovascular care team that represent the membership of the ACC, I want to welcome all of you to this meeting of the Professional and Corporate Consortium here at Heart House. And again, I want to welcome all of you to Heart House, which is the home of our cardiovascular care professionals. I want to thank all our faculty and our supporters of our clinical programs of the college. Just recognize some of you this morning. And I want to extend a welcome from our new CEO, Shal Jakovovitz, who is heading to Dulles Airport right now for a flight to San Francisco, and he extends his regrets, but he had another engagement that he had to attend. But he wanted to extend his specific welcome to all of you and to acknowledge what a force you are in contributing to patient-centered care and to American healthcare. I also wish to recognize, on behalf of the entire presidential team, your participation here this morning. And just recognize that this is the beginning of the 65th anniversary year of the American College of Cardiology. We were formed in 1949 in New York, and today, as I mentioned, we have over 43,000 members worldwide. I'm going to show a little video about the college. It'll give you some additional background.
One organization, more than 60 years. With 40,000 members worldwide, we provide care for millions of heart patients every year. Since 1950, we've helped decrease death rates from heart disease by over 60%. Every day, we're working to discover new scientific breakthroughs in cardiovascular medicine. We're continually educating our members and helping to train a new generation of cardiovascular health professionals. We're developing clinical guidelines to ensure best practices in treatment. We're sharing decision-making with our patients. We're promoting healthy lifestyles to help people live longer and better. We are committed to the vision of reducing heart disease and improving heart health. We are the American College of Cardiology.
And again, the vision of the college is that the members of the college will dramatically reduce the incidence, severity, and complications of cardiovascular disease as we promote prevention, reduce disparities in healthcare, and improve personal and population-based cardiovascular health. Our core values are known and are on our walls outside, but basically professionalism, the interests of patients are primary, knowledge, the college promotes growth, dissemination, application of knowledge, the value of the cardiovascular team, integrity, it's a member-driven organization, and inclusiveness. The college involves a broad range of volunteers that reflects the composition of our membership. Indeed, we mentioned earlier, we have over 43,000 professional members. We have over 100 million patient encounters per year across the college. Our annual meeting typically involves over 30,000 attendees. And again, we have in our registries millions of patient records. Our staff organization, led by Shal Jakovovitz, we have several divisions as noted here. We just went through a reorganization, and we are in the process of doing strategic planning. The college has major opportunities for member involvement in our committee structure, our chapters and sections, and of course we've expanded to councils, and we're representing numerous constituencies based on the interest of our members, as you can see here. 2013 marked the 10th anniversary of our Cardiac Care Associates membership, and we also created a designation for our members that recognizes advanced training. So the ACC and patient-centered care, the theme of today's meeting, you'll hear a lot about this. Hippocrates said, "It is more important to know what sort of person has a disease than to know what sort of a disease a person has." Expanding ACC's mission to transform cardiovascular care and improve heart health, we have brought patient-focused perspective into all of our college-wide initiatives. We've involved a public trustee. Deborah Ness joined our Board of Trustees last year, and honored to have the public voice in our Board of Trustees. And of course, we're focused on the triple aim of better health, population health, and affordable care. And as you know, the highest quality health care is effective, safe, efficient, timely, equitable, but most critically, patient-centered. And indeed, we have numerous patient-related quality programs that many of you either are participating in or supporting, as noted on this slide. Our National Cardiovascular Data Registry, it's been in existence since 1998, currently manages millions of records. As Peter Drucker, the healthcare economist, said, if you don't measure it, you cannot manage it. And the mission of our NCDR is to improve the quality of cardiovascular patient care by providing information, knowledge, and tools, implementing quality initiatives, and supporting research that improves patient care and outcomes. And again, many of you are familiar with our Pinnacle Registry, which already includes over 2 million outpatient patient records focused on coronary artery disease, heart failure, atrial fibrillation, and hypertension. These collaborations do not occur in a vacuum. We are cooperating with numerous professional societies, as noted here, including Heart Rhythm Society, SCAI, and others. And again, we focus on guidelines, performance measures, data standards, and appropriate use criteria. And recently, the NHLBI announced the new relationship with the college going forward. We will be producing many of the guidelines that you've heard so much about. And again, our national performance improvement initiatives that many of you are participating with, including our newest initiatives in championing care for the patient with aortic stenosis, participation in Million Hearts, atrial fibrillation initiative, and so on. We're proud of our partnerships with other organizations, including the Association of Black Cardiologists in CREDO, the Coalition to Reduce Disparities in Cardiovascular Outcomes. We participate in the Spirit of the Heart program, which was developed to aid patients and consumers in understanding that heart disease is preventable and heart-healthy practices are important for longevity. And our international focus, again, we are connecting international members worldwide. We have over 29 international chapters across the world. Our international membership continues to grow almost in an exponential fashion. And the future of the college, we began strategic planning this year, looking at 5 buckets of data, enhancing member value and engagement, public and population health, purposeful education, and the transformation of care. And again, our strategic plan guides the mission of the college, and we look forward in deploying this mission and working with all of you. And our strategic planning, again, is very topical because it is our 65th anniversary year, and this strategic plan will really chart our course over the next decade at a time of rapid and enormous change in the healthcare landscape. We have a digital strategy, which is a college-wide initiative that will also focus on patient outreach and all the different ways that patients interact with physicians themselves and social networking, and this has been a major initiative for the ACC. CardioSmart, you'll hear a lot more about this morning, but again, a program to equip patients and their providers with tools and resources that empower them to be engaged in their care decisions and to enable a more effective clinician-patient dialogue. And again, there's an entire CardioSmart ecosystem that you'll hear about. And our shared decision-making partnerships with other organizations, including our participation in the Choosing Wisely campaign, an initiative of the American Board of Internal Medicine Foundation. And Choosing Wisely helps physicians, patients, and other healthcare stakeholders think and talk about appropriate medical care, including overused or misused tests and procedures that provide little benefit or even potential harm in cooperation with Consumer Reports. We're proud of our relationship with AstraZeneca with regards to our new Patient Navigator program. You'll be hearing a lot more about this in the near future. And our partnership with the NHLBI in the Red Dress campaign. We participated in the 2013 Heart Truth event in New York City. You'll recognize Tony Braxton there, and among others, and some of the reporters from CNN and NBC News. So we have also had the proud collaboration with Mended Hearts, and I was pleased to participate in their 2013 convention. What the slide says is essentially the lecture I gave was New Advances in Cardiology, a focus on TAVR and the mitral E-clip. And I had the privilege of, again, participating in that particular meeting. And this is a slide that was tweeted by Elizabeth Taylor when she had her eValve procedure at my home institution several years back, but really a focus on talking to patients about new technologies, both in both drug technologies and also device technologies. So making the connection, this is what this meeting is all about. It's about we need partners like you to help our members and the ACC as a whole move forward to create better patient outcomes. The college is committed to making this connection a priority by working with our members, other medical and cardiovascular societies, and partners like all of you to create engaged, empowered cardiovascular patients. The ACC is excited about our patient-centered endeavors that promote cardiovascular health, empower the patient to be even more proactively involved in his or her care, and strengthen the doctor-patient relationship. When I was chair of the Board of Governors several years ago, one of the initiatives we had was the Year of the Patient, and that was designated by then-President Fred Beauvais. Well, subsequent to the Year of the Patient, we made the pronouncement, it's always the Year of the Patient. So going forward, it's always the Year of the Patient, which again aligns with our mission. And the mission of the American College of Cardiology is to transform cardiovascular care and improve heart health. And we look forward to working with all of you, and I hope you enjoy the rest of the meeting. Thank you very much.
Every time I hear one of our offices talk about the college, I just get a little chill of pride. And so thank you, John. And finally, we really are encouraging discussion. Did anybody here take a vow of silence before coming? You know, John, Dr. Harold, you may not know this, but years back, cardiology was already getting somewhat dissatisfied with practice, and one of our former ACC members actually was so sick of talking to patients and families. He joined a monastery, took a vow of silence, was allowed to say 2 words every 10 years. So the first 10 years, nothing. His time came after 10 years, he stood up and said, "Food bad." 10 more years go by. His turn comes again. Bed hard. Another decade. Finally, his turn comes again. 2 words, "I quit." The head of the monastery said, "It's a good thing you've done nothing but complain since you've been here." So the point is, we do really want you to participate. We're going to have Q&A, we're going to have discussion. Please, people who are going to make presentations are eager to hear your questions and comments. So we're going to move on to the formal part of the program.